Autism is a neurodevelopmental condition predominantly characterized by differences in social communication and interaction, and repetitive and restricted behaviours. Autistic people may also experience sensory information differently to non-autistic people, and some may develop difficulties with anxiety related to their autism. Autism is one of the most commonly diagnosed neurodevelopmental conditions. In the UK, it's estimated that at least 1% of children are diagnosed with autism, with 3 to 4 times as many boys diagnosed than girls. However, the difference in rates of diagnosis between boys and girls is not believed to be a true reflection of differences in prevalence. We'll come back to this later in the video. What causes autism? Like most traits that emerge across development, autistic traits are likely to be caused by a complex interaction between both genetic and environmental factors. Several lines of research suggest that autism is related to various genes. For example, autism is more common in children who have genetic disorders such as Fragile X syndrome and Down syndrome. Around 5 to 8% of autistic people's siblings also have autism, rising to 82 to 92% if the siblings are identical twins that share exactly the same genes. Whilst these lines of research suggest a genetic component to autism, how genes are related to autism and how they interact with environmental factors is currently not well understood. Autism is commonly described as a spectrum condition. This means that there is no one set of autistic-specific traits shared by all autistic people. Rather, autistic people can have different profiles of strengths and weaknesses across a broad range of traits. How much these traits impact autistic people's lives can also vary. Many individuals diagnosed with autism are not held back in achieving their goals, so autism can be viewed as a difference, although some children can experience challenges in their development, friendships, and school lives, and in that sense, features of autism are sometimes described as difficulties. Autistic people might understand verbal and non-verbal language differently to non-autistic people. Some autistic people may have good verbal language skills, but may have difficulties in quickly interpreting the less obvious meanings in communication, such as meaning conferred by gesture, tone of voice, and non-literal language such as metaphor. Other autistic people can have very limited verbal abilities and experience difficulties in communicating their thoughts and emotions and inferring other people's feelings and intentions. These differences in communication can often present challenges for autistic people when navigating the complex social world. Other autistic traits relate to behaviours, interests, and activities. These can include intense interests as well as repetitive and restricted behaviours such as the desire to stick to known routines. Sometimes, autistic people can have difficulties in quickly interpreting the unspoken rules of the world. This can make the world an unpredictable place, and keeping to known routines makes it easier to anticipate what might happen next. Other repetitive behaviours might include hand flapping, rocking, or the repetitive use of an object like playing with a pen. These kinds of repetitive motor movements can help autistic people calm down when they feel stressed. Autistic people might also experience over and under sensitivity to differences in senses such as sound, light, smell, temperature, and pain. For example, an autistic person who is sensitive to sound might experience the background noises in a classroom as intensely loud and anxiety-inducing. Someone who has an insensitivity to pain might not notice if they've cut or hurt themselves. Whilst anxiety itself is not a core trait of autism, many autistic people can suffer from anxiety. In fact, it's estimated that anxiety affects around 40% of autistic individuals. Differences in sensitivity to noise and touch, navigating uncertain situations, and difficulties in understanding social situations can make the world a stressful place, contributing to the anxiety that autistic individuals may experience. So what misconceptions exist around autism? One misconception is that autistic people do not feel empathy towards other people. However, this is not true. Some autistic people may have difficulties in picking up on the subtle cues that convey how somebody is feeling in certain contexts. For example, they might be quicker at recognizing emotions that can be generalized to a broad range of contexts, such as happiness, sadness, fear, and surprise, compared to more complex emotions that are bound to specific contexts, such as interested, bored, excited, and pride. An autistic person may understand how another person feels in a given context, but responds to it in a different way. It's also been argued that autistic people can be overstimulated by other people's emotions and become too overwhelmed to respond to these and shut down. Another common misconception is that children with autism are unable to notice social rejection. Because autistic people understand and communicate about the social world in a different way, for example, they might avoid direct eye contact or want to spend time on their own, it might appear that they are not interested in social relationships. While autistic people may interact differently in social situations, they value friendships, notice social rejection, and feel loneliness in just the same way as non-autistic people. Sometimes it's believed that children with autism never like to be touched. Differences in sensory experiences are common in autism. However, different autistic people have different sensory profiles. Some individuals show hypersensitivity to touch and may react strongly even to being touched lightly, whilst others show hyposensitivity and may need more input to respond to touch. Some autistic people may also not see a particular instance of affection or touch as socially relevant. Sensitivity profiles in autism is currently not well understood, and further research in this area is required. Another common misconception is that autism only occurs in boys. Whilst 3 to 5 times as many boys are diagnosed with autism compared to girls, this difference may not be a true indicator of the actual prevalence. Because many autistic traits relate to social behaviour, and boys and girls have different social experiences, autistic boys and girls may develop different coping mechanisms. For example, autistic girls may be quieter than boys, or they may be more adept at masking their traits due to social pressures, both of which can make autistic girls' traits less visible than autistic boys, and it's believed that autism in girls may be underdiagnosed. Thank you for your attention, and don't hesitate to check out another one of our videos on misconceptions in neurodevelopmental disorders.